and gentlemen. I am Dalia Gamil. Welcome back to Healthy and Happy Living with Tiryak. Hopefully you can hear my smile. Today on the podcast episode, our guest is a lecturer in health sciences and a passionate advocate for more patient-centered, accessible healthcare and founder of Archway Family Medicine, direct primary care in Pasadena and Webster areas. With a background that bridges both clinical care and healthcare education, Dr. Cindy Dafashy brings a unique perspective on how we can rethink the way primary care is delivered. Please join me to welcome Dr. Dafashy.
Thank you so much, Dalia. I'm so honored that you wanted me to come speak on your podcast. I'm very excited for our talk today.
Thank you, Dr. Dafashy. The honor is ours. In this episode, we're diving into direct primary care. It's a growing movement that's changing the doctor-patient relationship by removing insurance from the equation and replacing it with a simple, affordable monthly membership. We'll talk about how this model works, who it benefits, and how people can navigate the healthcare system even without traditional insurance. Whether you're a patient or a provider, this is a conversation you don't want to miss. Dr. Dafashy, please share with us your personal journey.
Sure. So I grew up in San Antonio, and I went to Rice for my undergrad. Initially, when I went to college, I wasn't planning on going to medical school. It wasn't really my goal, though it might have been in the back of my mind. And as I moved through undergrad, I realized that was something I did want to pursue. But what I love to share with people is the first time I applied to medical school, I didn't get in. And it really forced me to decide if this was a path I really wanted to take. Did I really want to make the extra effort to really, improve my application or whatever it was that needed to be done? And I did a one-year master's program in Fort Worth, a master's of science in medical sciences. And that really solidified to me that this was what I was meant to do. I didn't apply to medical school that year. I wanted to spend some time just building up my application a little bit more. So I ended up doing research at UTMB in Galveston for a while. And that, I think, really made me realize where my passion was when it came to medicine. I started getting involved with a lot of community outreach organizations. And though I didn't know what specialty I wanted to do, I feel like it set the stage. So once I did get into medical school at A&M, and as I moved, through my training, I realized that I really loved that community aspect. I really loved speaking with patients and building that connection and developing these lifelong relationships. And it kind of just fell into place that family medicine would be the best suited field for me. So I applied to family medicine and I did my residency back at UTMB in Galveston. So I came back. And when I was in residency, I realized that relationship that I was seeking was really being fractured by the healthcare system. Not by, my peers, my patients, or the physician, but really the system that we were being forced to operate in really affected that patient-physician bond and that trust, because ultimately a lot of our decisions were being driven by what health insurance was asking us to do. So I learned about the direct primary care model, or DPC model, from my time in residency, and it just blew my mind that there was a system out there that could could operate in its entirety without having to rely on health insurance. And it really opened my eyes that when it comes to primary care, at least, insurance really does not have a role. Insurance is there for those big ticket catastrophic expenses that you're not really dealing with in the primary care setting. So during residency, I made that decision that I wanted to open my own direct primary care practice. So right out of residency, I spent a few months, researching. Well, I spent a year and a half of residency researching. And then I took a few months after residency to kind of do the logistics, and then I opened my own practice. And it's been very exciting. It's exactly what I wanted in a career as a physician. So I'm very happy that I went this route.
Really inspiring. So please explain what direct primary care is in simple terms for someone who never heard of it.
So I like to explain direct primary care as just like you can think of a gym membership. You pay a gym a monthly membership fee, and you can go whenever you need, at whatever hours that you need, and use whatever equipment that they have there that you might be looking for. It's that same approach, but with your primary care doctor. So my patients pay me a monthly membership fee, and with that, they have much more time and access to me as their doctor. If they want to see me in office, they can do so. If they want to text me, if they want to email me or call me, it really doesn't make a difference. And I'm not billing them per encounter. All of those touch points are covered under our membership fee. So patients don't have to feel like, one, that they are being nickeled and dimed every time they go see the doctor. And then when they actually do come and speak with me, they are getting significantly more time to discuss all their needs. And primary care, my goal is to be the main doctor that they go to for any healthcare need. And if they need to see a specialist, I'll help coordinate that. But if I'm going to be their main doctor, that person in their life that they go to for everything, I need to have that time to go over more than just a 10-minute visit. So with the membership, all my patients are guaranteed that their visits are going to be at least 30 minutes, if not longer, and almost always it is longer. Especially with my new patients, I spend maybe an hour and a half with them, really diving into their health beyond just that one issue that came to the top of their mind, which is why they were looking for a doctor, but really diving deeper into their entire health history and how they live their life. So I just could not do that in a traditional primary care setting because of the constraints that insurance has in the way that they reimburse physicians. You're kind of forced to see 20, 30 patients in a day, 10 minutes at a time, in order to be compensated for those visits. So this model allows the patient to get that time back that they remember when they used to think about what doctors, that relationship. It was, oh yeah, I just called my doctor and they answered the question. Now when people think of going to the doctor, it's incredibly frustrating, complicated. They think of these automated phone lines that direct them to push 1, 2, and 3, and then they never get a call back. So it's really working to bring medicine back to what it used to be with that, added modern touch of texting and emails. So it's great, in my opinion.
I think it's great as well. 30 minutes for a primary care consultation is quite generous. And if it can go to 1 hour or 1.5 hours with unlimited calls and texts, that's extremely generous. So what was the moment that made you question the traditional insurance-based healthcare system?
I don't know if I had a single defining moment. It was probably the sum of repetitive moments. I think something that always stuck out to me when I was in residency was how often I would have patients ask me how much something was going to cost, and I just could not answer that question. Patients would say, okay, you're sending me to x-ray. How much is this going to cost me? And all I could say was, I don't know. We'll just have to see what your insurance is willing to cover. And a lot of times that meant after they actually got that service fulfilled. So they would go and get, an x-ray or a CT, and then they would get a bill of how much it would cost. And to me, in no other industry in the world are you buying a service without knowing what that cost is up front. So I think that's really what struck me as problematic. I mean, there were many things that were problematic. And when I learned about direct primary care and the focus on price transparency, not just with our membership fees, but all across the board. With direct primary care, we know how much everything costs on a cash basis. So if a patient has insurance, they still can know what the cash value is, and they can make that decision. Do I want to use my insurance to cover this, or do I want to pay cash? But for my uninsured patients, knowing the cost up front was just invaluable. I mean, it was life-changing for a lot of patients, and they can actually financially plan for things that they need for their medical care and not have to have that fear of the financial unknown.
Awesome. So I believe that the direct primary care monthly membership model is a game changer for both patients and providers, because the patients can plan their finances and the providers can plan their time, and it's a win-win.
It's a win-win. People don't believe me that it's a win-win. A lot of people ask me what the catch is, and I say there really is no catch.
So maybe if we hear a story of a patient who significantly benefited from switching to direct primary care, this can convince the patients that there is no catch.
Yes, so many examples. And I think the patients that find the most value with this model are uninsured patients. I think there is a lot of value there for patients who do have insurance that have just been kind of cut short on their time and their access. But really, the uninsured population, they are the ones that are kind of just scraping by. They're going to urgent cares or ERs for really simple needs. There's no continuity with a provider. They're having to tell their story all over again. Whereas I have patients who, I've spent, first of all, that first visit, I spent so much time with them. I know the ins and outs of what they've been dealing with. So every time they reach out to me, they're not having to explain, their fear of driving a certain distance, or maybe a patient has a really strong aversion to medications and they don't want to go to a doctor and be told to take the medication again and again and have to explain, I already know, hey, this patient prefers a more natural approach. I'm never going to suggest that up front if that's not absolutely necessary. So I really think that personalized approach is what draws patients to this model. If I were to think of an example, something that I enjoy doing for my patients is, along with financially navigating the healthcare system, if I can find a sample of that medication that they need for them for free, then I'm going to give it to them. So for example, I have a few patients who are uninsured that have diabetes, and they have just been very, quote, non-compliant. I have an issue with that term, but a non-compliant patient with their treatment plan because of cost. Insulin is not always that affordable for a lot of people. So I found that I can get a lot of insulin samples for free to my office as a physician, and I just give them to my patients, no charge. And they are actually able to now make those other lifestyle adjustments because they're not having to worry about the medication side, which can sometimes be really frustrating. A patient, if they can't afford a medication, they say, well, I can never get better, so I'm just not even going to try. I'm not even going to try to move my body or eat better. But now that they know that, they have this sample coming to them from my office, they don't have to worry about that aspect of their care. They're encouraged, okay, I have this medication on board. Maybe I can start doing a little bit more activity on my day-to-day, or maybe I can start to read more of the nutrition labels and understand. And now I can text my doctor and check with them, hey, does this food product look like something that I should be eating, or am I missing something here? And then we can talk about nutrition, which was completely absent from the traditional system, diving into really the details of how to make lifestyle changes. I never would have had time for them before.
Those are lucky patients, especially if you're working hard to get them their medications at the best price possible. So what kind of healthcare access do your patients typically get under the direct primary care membership? Are there any limits on visits or texts or longer consultations? Like, what patients exactly can expect from this membership?
So I will say every direct primary care clinic does things differently. So if you're looking up my clinic, I mean, these are the answers I give you are based off of my clinic, but there is a saying in the direct primary care community, if you've seen one DPC, you've only seen one DPC. So at least in my clinic, the way I have things structured, I don't have any limits on visits. Truly, patients can be seen whenever they need. I try to accommodate my established patients same day or next day, especially if it's a more urgent need. And then if it's a new patient, I usually try to fit them in within the week that they sign up. When it comes to texting or calls, I let patients know that if it is an urgent or emergent need, any hour of the day, any day of the week, they can reach me. If it's a more routine kind of question and they send the text on a Saturday, I just may not respond till the next business day. But if those urgent things come up, which I have had many instances, I've had a child who was vomiting at 9 p.m. I've had someone who fell down Saturday morning. These things, it doesn't matter to me. I want to save them in urgent care or an ER visit if they don't need to go, or at least help them make that decision if that is the right place to go next. So when it comes to access, that's kind of how I set things up. It is unlimited in the number of visits, and then time-wise, I'll set their actual appointment times, 30 minutes, 45 minutes, an hour, based on that person. I know all my patients really well, so I know who talks through things quickly, and I know who needs a little bit more time. So I don't try to set any kind of hard limit when it comes to the actual appointment times. For me, that's my way to keep things very personalized. In addition to those that access and that time that they get, my patients will also have access to discounted labs. That is probably one of the biggest benefits I think that my patients enjoy, is getting labs at a crazy discount than what they were previously paying. So, for example, I had a patient come to me one time saying, they were uninsured. They got an annual set of blood work, and it cost them roughly $150. And then I showed them, if they had gotten those labs with me, which I think they were going to be getting it soon anyway, it was just under $20, because that is the true cost of these labs. Most common labs are under $5. But when you ask insurance to pay for labs, they raise the cost, and insurance won't always cover every labs unless they're considered, if they fall in their strict criteria of what's covered or not. Something as simple as a vitamin D check is often not covered by insurance. And if you ask insurance to pay for that, they may be billed a few $100s, or, they won't know how much their lab bill is going to be. Whereas if they just paid cash up front with our discounts, that vitamin D was $10. So when it comes to labs, I think that is probably my favorite benefit that I can offer my patients.
Very interesting point. Talking of labs, do you think that some patients have insurance, if they heard about the direct primary care model, will find it more cost efficient than using their insurance?
That is a very good question. So I always tell patients, I am not a substitute for insurance. So I'm still just a primary care doctor. I think all patients, if they can afford it, should have some sort of coverage for those emergency needs. If they ever get hospitalized, or they need a surgery, or they need very specialized medication, or if they get cancer, these are things that we can never predict. And I think coverage can look like many things, the most common being health insurance. But there are other types of coverage plans out there that are structured a little bit different from health insurance, but still offer those same kind of catastrophic protection. So I tell people, I am not a substitute for insurance. However, if you cannot afford any kind of coverage and you have no access to any kind of health care, really direct primary care, I think, is the best way to get high quality and comprehensive medical care and help you reduce your medical costs and try to keep you out of those urgent cares and those ERs where you will get those hyperinflated bills. So I don't ever discourage anyone from having health insurance. I think those decisions really are going to be personal and depends on their financial situation. I'm so happy to talk with patients when they want to figure out which insurance plan they choose, because they may actually end up choosing a different type of plan, whereas before they were maybe choosing a very low deductible, high premium plan. They may find that they're getting the majority of their care through me, that they no longer need that kind of expensive plan and they can go for a more affordable plan. So it's something I'm very comfortable walking through with them. You mentioned I teach this class at Rice, and I'm teaching undergrad students this same concept of really how to pick your health insurance and how to make those decisions. What do all these words mean on the blue papers that just can be very overwhelming for people? Yeah.
Good advice. So still some people are very anxious about being uninsured. So what would you say to someone who is hesitant to step out of the traditional insurance system?
So the thing about direct primary care is, though it may feel like you're stepping outside of the healthcare system, you're not really completely isolated from it, because we still work alongside that system for our referrals, for our imaging. If we need a hospital, if we need specialized care of any kind. So we're not really stepping outside of the system. What we're doing is approaching primary care in a much more direct fashion. So patients don't have to feel like they have to rely on a third party kind of make decisions for them, which is what tends to happen when you have insurance playing a role in primary care. So if my insurance is telling me they are only going to cover this imaging, this MRI, as long as I get an x-ray first, now I'm having to pay for an x-ray, schedule an x-ray, get that report, get an office visit, and then get the MRI. In direct primary care, we're saying, no, I know that the best way to image this condition is with an MRI. I'm just going to send you directly to the MRI, and here's how much it costs cash, which is probably going to be less than what your insurance would ask you to pay for. So it's just more direct. You just skip steps that insurance has kind of put into place that are just unnecessary. They're just burdensome. So I'm still using the traditional healthcare system for their hospitals and their imaging centers, but how I get my patient to receive the care that they need is much more straightforward. So it feels like you're stepping outside of the traditional system because we've somehow equated insurance as being the almighty driver of every decision we make, and it's not. It is a financial product. It is a third party. Should be in the back burner. The real decisions should happen between the patient and the physician. But it's just our healthcare system has morphed that people, they correlate having good, quote, health insurance means I have good health care, and they're just two separate things. One's a financial product that cares nothing about your actual quality of care. The other is a human being who's caring for you.
So what do you think of a patient who is thinking to have an insurance for emergency only? So basically, I think this is going to be an equilibrium between insurance and direct primary care, because basically the patient might need insurance for emergency, but for the direct primary care, it's totally very cost efficient if the patient is not using the insurance. I think the membership, the monthly membership, is going to be more cost efficient for the patient, even if he wants to see a specialist. So basically, from your words, would we say that the patient will need insurance for emergency only? How he is going to deal with the specialist equation?
I think it would depend on the patient's current medical condition. So if this is a young, healthy individual who has not had any real medical concerns, but does want to be proactive about their health and wants to work on preventing and kind of keeping track of any things as they come up, for those patients, direct primary care works very well with a catastrophic insurance to cover those, you never know what might happen. If it's a patient that has more chronic conditions where, say they already know they've had multiple surgeries on their back or their knee, or they require special infusions, they know that they already require a lot of resources from the healthcare system, I might say they may not benefit from that catastrophic plan. They may need a little bit more coverage because they are already requiring more assistance. And I'm still going to be that person to manage and be the coordinator of all their care and help them save costs where they can and do as much as I can, from a primary care standpoint. But when it comes to when they're choosing their plan, it really just depends on that person, where they are in their life, what they expect to happen. A young 20-year-old, the chances of them having, a bad fall that fractures their hip is significantly less than the 80-year-old female with osteoporosis. It really just depends, I think, on their current status, their health status. And that can change. That can change through time. They may find that they do well with emergency coverage in their 20s and 30s, maybe even in their 40s. And then they see things start to change because, everyone ages. It's a part of life. Things come up. They might find that their needs out of their health insurance changes as well.
So this brings us to a point where patients are having chronic illnesses. What is the realistic expectations a patient with chronic illness or complex health need can expect from direct primary care?
So it would depend, but the role of a direct primary care physician, if someone has chronic needs, a lot of times it's medication management. So if someone is stable on certain medications, they just need that refilled. They need someone who can check on things, make sure that they're okay on the medication. The dose doesn't need to be changed. Most of the time, that very well can easily be managed by a primary care doctor. Sometimes I have patients go to see a specialist just to help me fine-tune the diagnosis and the best treatment plan that maybe I'm not familiar with. And then they come back to me and I actually manage that medication and keep them going on it. They don't have to continue to see that specialist for routine follow-ups to have a 5-minute visit that says, yep, this works well for you, I'll write you your next refill. They can get that from me. That's not an issue. If it is a situation where they do require, for example, some patients require special infusion medications, they're always going to probably need to see their specialist for that. Or if it's a surgical condition, I do zero surgery, so I will never be of help when it comes to surgery. And if they need follow-up, if they have cancer, they need to see their oncologist. I can help manage the nutritional side of things, keeping their health optimized as they work through that service. So there is always a role for primary care. It shifts around depending on what the patient has.
Awesome. So talking about direct primary care model, how direct primary care model offer the equilibrium in addressing general population needs and at the same time addressing healthcare inequality or affordability for underserved community? Do you think that this is a role model solution for those patients?
There is the cure-all for our broken healthcare system. But I do think it meets certain needs, and it can catch people who fall through the cracks, in particular uninsured, purely because it really is a group that either avoids the doctor altogether, or they get a very mismatched, a very all over the place kind of care. They're going to whatever clinics open. So it provides continuity of care and still high quality for those patients, the ones who really just have been scraping by and getting their care here and there. When it comes to the general community, I mean, we're still general primary care doctors, just like any other primary care doctor you'll see. I'm family medicine trained, which I see all ages from newborn to end of life. I do women's health. Some family medicine doctors will also do pregnancy care. Some primary care doctors have, more in-office procedures that they do. Some do less. The medical side of things, the science, is not going to change whether they see their primary care doctor through a traditional clinic or through my clinic. What they're getting is more time with that doctor, and they're getting a relationship with that doctor. So again, that kind of goes back to that question of, are we really stepping outside the healthcare system? I don't want people to think that they're getting some outwardly medicine, it's still traditional Western evidence-based medical care. It is just that human aspect is what changes.
Awesome. So this brings us to the point of the role. What is the role do you see that direct primary care is playing in the broader transformation in the United States healthcare system? So do you see that this is going to be a transformation?
I do. I see it already. I mean, I think just within the last 5-10 years, it has really transformed, especially on the provider side of things, how people view primary care. Truly, primary care is often, from the medical side of things, looked as one of the least favorable fields because it doesn't pay well, because they're overburdened with paperwork and administrative needs, often from health insurance, and they're rushed and they're having to take care of so many conditions in such a short amount of time. And this is for the first time, I think, made primary care appealing to our trainees, to our interested pre-medical students and medical students. It's showing that you can still live a very enjoyable life while practicing primary care. So I think on that side, it has definitely started to change. I mean, we see people moving from a traditional health clinic to the DPC model just in the hundreds, if not thousands, every single year. It is growing. I mean, direct primary care is all over the country, and every year I see more and more clinics pop up. And Houston is a great example of where we've seen that boom in growth. When it comes to the bigger healthcare system, it definitely has started making waves. I think there is a lot of focus now on price transparency that wasn't there before. That, not to say that direct primary care is the reason these changes have come about, but I think this model has brought it to people's attention. Man, I really don't know why I don't know how much things cost before I get that done. I think it's just bringing concepts to the forefront of our minds, and now it's playing out in health policy and on a bigger scale. So I do think direct primary care is kind of shaking things up and realizing that we have too many middlemen involved in the doctor-patient relationship. Even companies, popular companies like Cost Plus Drugs. I don't know if you've heard of, you probably have heard of Cost Plus Drugs, Mark Cuban's online pharmacy. They are cutting out certain middlemen so that patients can get their medications at the wholesale cost, the true cost of these services. And really that's what direct primary care is doing. So I think it is going to just continue to grow. I don't think it's going to replace insurance. I think insurance will always be there, and it's not going to solve all the problems that we have, because we have many issues in our healthcare system, especially when it comes to cost. but at least it's doing something. And it's starting with primary care, and we are starting to see it ripple out into different specialties who are also taking this direct care approach. I see, OBGYNs, cardiologists, endocrinologists, rheumatologists, GI, all these specialties that are trying to incorporate the direct care model in some way in their specialty. And it's very cool, very exciting, I think.
Interesting. So, what would it take for direct primary care to become more mainstream or supported at the policy level?
I think it just needs to be more well known. I think more DPC clinics need to open up, more patients become familiar with it. Word of mouth is huge in direct primary care. A lot of people are just unfamiliar with the model. I mean, this entire discussion may be the first time someone's ever heard of this model, and that's awesome to me. That means that's one more person that's learning about it, and it may not benefit them, but it may benefit someone that they know. So spreading, the word of direct primary care, I think at a very local level will inevitably spread to a state level, a national level. It already is starting to creep, I think, in some more national talks. And, like one of the big policies that are being debated right now is how people might be able to use their HSA or their FSA to pay for these memberships, and how can we restructure the IRS code. So it's already out there on a bigger policy level. So I think, to answer your question, the way we can continue to make a note is just talking about it and just sharing the information with someone who you think might benefit.
Perfect. So, at the level of advice and action, what should listeners look for when considering a direct primary care practice in their area?
Right. So, like I said, every direct primary care clinic does things their own way. So, most of these clinics will offer some sort of free intro call or some kind of consultation to see if it's a good fit for them. So I would just definitely take advantage of those and talk. If you can talk to the doctor directly, you really can get a feel of their approach to medicine and their practice, and make sure that it's a clinic that is going to be able to care for what you are looking for in your doctor. So, for example, if a clinic does not offer any sort of in-office procedures, for example, or dermatology procedures, and you're someone who is really looking for that in their primary care doctor, not having to go to a dermatologist to remove, skin tags or check on moles, then that may not be a good fit for you. So some people may already have set list of needs. Someone may know they get injections, joint injections every now and then for their knees or shoulders, whatever it may be. So I would say just check out the websites, maybe look at their social media pages. They're going to advertise what they do because they want to attract a specific type of patient population. So, just try to reach out. Most direct primary care doctors, they want to talk to patients directly, and they have the time to do that, to talk to interested patients, which is unique. You really don't see that in a traditional clinic. You just get scheduled with someone that you read maybe a 2-sentence bio on their website. So it's okay to kind of dig deep and figure out if this person's the right fit for you.
Great. Dr. Dafashy, what's one myth about direct primary care and relation to insurance that you would wish everyone would unlearn now? Or debunk this myth?
So I get a lot of questions about if direct primary care is for rich people only. If it is what people know as concierge medicine, and I have just a resounding no. In fact, I like to explain direct primary care as concierge level care, but with an affordable price tag for the everyday person who wants that same high quality attention without feeling like they're shelling out thousands of dollars every single year just to have that attention. People are familiar with concierge medicine, and I think direct primary care is kind of an offshoot of what concierge medicine is. You're paying a membership fee for time and attention from your personal doctor, but the differences really lie in that concierge medicine typically charges an annual membership, so you have to sign up for a full year, and they normally also bill insurance on top of that, whereas direct primary care has zero to do with insurance, and almost always it's a monthly membership only. And every clinic differs, but my clinic, for example, we have no contract of time that someone's required to sign up, nor do I have any cancellation fees. So if a patient just wants to test it out for a month, they are very much welcome to do so.
Interesting. So if you could redesign the American healthcare system from the ground up, what's one change you'd make on day one?
This is a very hard question because I am aware of the many, many problems we have. I think if I were to pick one thing that I really wish would be different, it's the price transparency. I think every healthcare provider, facility, whatever it may be, should be posting their prices up front and in an accessible manner. Because the recent laws have passed where hospitals, for example, do have to post their prices, but that information is still not anywhere near accessible in the way that it should be for the average consumer to even understand what they're reading. I just don't understand how every other industry has a price, they put forward the price, the consumer makes the decision, and then they use the service. I don't understand why that doesn't happen in healthcare. So I would push for, price transparency across the board. I used to say even a set standard price across the board, but I don't think that's very realistic. I think just making those numbers known is a much more reasonable, in my opinion, first step.
Awesome. So we all have the same dream.
Yeah.
Dr. Dafashy, what's giving you hope right now in healthcare, especially in your work with patients and students?
I think it's with the students, honestly. So my undergrad class is normally majority pre-medical students, and I can see that they are recognizing the state of our healthcare system and how important it is to get involved, whether on a policy level, an educational level, just personal awareness level. I see a shift that I don't think this mentality even existed when I was a student, medical student, even a trainee. This awareness of thinking of their career beyond themselves, but their role in the ecosystem of the healthcare system, of the community. So I'm very excited to see this next generation of medical trainees and how they will use this knowledge that they now have access to, and they're seeing these models before they even start training. If I had heard about direct primary care as a pre-med student or even as a medical student, I feel like I would have decided on the field way earlier. I'm glad I fell into primary care anyway, but I just think more students would choose primary care if they knew this was even an option. So I'm very excited on the educational side and where that's going.
Exciting, and we are all grateful for all the role models who paved the way for those students and new generation healthcare professionals to offer direct primary care and other care for all patients. This brings us to the end of today's episode. A big thank you to Dr. Cindy Dafashy, founder of Archway Family Medicine, Direct Primary Care in Pasadena and Webster, Texas, for sharing her inspiring journey, expert insights, and passion for patient care. If you are in Pasadena or Webster areas and looking for modern, compassionate, direct primary care, be sure to check out Archway Family Medicine. As always, thank you for tuning in. Don't forget to subscribe, leave a review, and share this episode with anyone who could use direct primary care today. Until next time, stay healthy and keep smiling and take joy wherever you go.